I am honored to be able to be here at this conference to give you a talk about what I've learned from burnout and how we need to reinvent the workplace. Let me begin with the World Health Organization official statement about burnout, and this came out in 2019. And as you can see, it's a syndrome resulting from chronic workplace stress that has not been successfully managed. 2 points. Chronic, that means this is a high frequency thing. You have these chronic stressors every day, most every day, not occasionally. And that's an important point. Not successfully managed, it could be managed by the organization, the hospital, the team, you yourself. All of those are part of it. It is characterized by 3 dimensions: exhaustion, that's the stress response; the cynicism, the negativism about the job and why am I here and what you don't like about it. And thirdly, a negative response to yourself. I'm not doing so well. I don't like this. Perhaps I've made a mistake. Last point I want to make about this is that World Health has clearly said it is not a medical condition, even though people somehow treat it as though it's a personal disease. And we'll get back to that point later. Another thing that happened in 2019 was the pandemic, which really disrupted the workplace and the world of work. Working too close to other people, not having protective equipment that you need, long hours with enclosed spaces, etc. And so this is made the workplace even more unhealthy than it used to be. But it turns out we've known for quite some time that workplaces are not always healthy places for human beings. There are a lot of work conditions that are highly stressful. Long hours, high demands, lack of control, low social support. And those kinds of conditions on a chronic, high-frequency basis actually have negative effects to the people who work in those organizations. So you see healthcare costs, you see errors, you see absenteeism, burnout and depression. So if anything, the COVID pandemic has made the concept of unhealthy workplaces for the workers an even more critical situation. So the question really now is, well, what are we going to do about this? Because it's getting worse. And the common response is usually to help people cope. It's a stressful job. It is what it is. You're just going to have to get used to it. But the burnout research points to something else. It's the job. It's the chronic workplace stressors that are the source of the problem. So you need to fix the job, to improve it, to make it better for people to work, not just helping people cope. It's really about preventing burnout, how to make it less of a risk, less of a hazard for people. And that is to focus on a better match between the job and the person. So we really need to be thinking out of the box, thinking in much more creative ways. How do we improve the environment in which people do important work like healthcare? So in a sense, burnout tells us more about the situation than the person. It's like the canary in the coal mine. It's a warning sign. If people are starting to have burnout and in large numbers in healthcare settings, it's saying there's something not going well in the job. The canary is telling you that the coal mine is full of toxic fumes. You can't survive there. That's what the canary is. It's a signal. The response should be, what do? You don't fix the canary, you fix the environment. It's not to get a tougher bird who can be resilient. It's how do you make the environment more healthy, less toxic? And that's really the lesson of burnout. Turns out that if you think of the match between the person and the job, there are actually 6 areas that we have found that are critical for understanding burnout. The first mismatch between job and person is demand overload. There's way too many demands of what has to be done and by when, and there is a low level of resources to meet those demands. You don't have the equipment, you don't have enough people, you don't have enough time. And when you get that kind of mismatch, you'll certainly get the exhaustion and the stress response. But there's 5 other areas. One is a lack of control, that you don't have enough say, enough choice. discretion in terms of how you can carry out your work in the best possible way. Third area is when you're doing something well, you're not getting much recognition or pats on the back or thank yous, insufficient reward, which is the feedback for doing a job well. Breakdown of the workplace community. By this, we mean a kind of socially toxic community. People do not get on well with each other. They, in fact, are competitive in a destructive way. They don't help each other. They are rude and mean and even bullying. And when you're working in that kind of a community, burnout can be a real problem. Fifth area has to do with the absence of fairness, so that whatever the rules are, whatever the policies are of how we do things, they are not being fairly applied. And so this is where discrimination and glass ceilings and where cheating and getting ahead unfairly are living when we don't abide by a fair process. And finally, what we see is value conflicts. That people are working in a way where they have to do things that they find morally wrong or ethically wrong or needed but very, very hard to do. You have to tell patients they cannot see their loved ones as they're dying. And you are caught in this moral injury, these value conflicts of not doing the kind of work in healthcare that I want to do. And this can be a huge mismatch that can lead to burnout. Any one or more of these 6 areas of mismatch will lead to more burnout in the future. So there are many things about that unhealthy environment, not just workload, but a lot of other things that actually are critical. So I want to say a little bit more about those 6 areas, but let me first point out that there are 5 profiles that we measure through the Maslach Burnout Inventory of work experience. Burnout is not the only one, as you probably can guess, but here's the difference between them. Burnout is 3 high frequency scores on cynicism, exhaustion, and inefficacy. When you've got all 3 together, that's when you're talking about the response of burnout. When you're talking about engagement on the opposite end, you're not having any negative scores. All 3 of those are actually positive. And if you have exhaustion, it's only occasionally. It's not high frequency. In between are 3 other profiles of work experience. One is cynicism only. You are not exhausted and you feel good about what you're doing, but you really don't like the job and the environment and the people in it. That's disengaged. There are other people who only have the exhaustion. They feel fine about the place where they work. They feel fine about the work they're doing, but they're tired all the time. And they're overextended. And then there are others who are not exhausted and are fine with the job, but somehow are feeling like no matter what I do, it's just not very good enough. Or maybe I've made a mistake. Maybe I shouldn't be here. So those are the 5 different profiles. And it turns out if you look at their environments, they are quite different in terms of how they are experiencing what's going on. So this is data from large samples of healthcare workers in North America. The 0, the baseline, is kind of the norm, the average for these healthcare workers. If you see on the left, you can see that people who are engaged in all of those areas, they're doing better than average. They're most, really, this is good. Far right, this is burnout. All of those areas are looking bad. And it's not so much workload. Notice how really negative they are in terms of the reward and recognition, in terms of the values, in terms of the control that they have over their work. They're experiencing their work in a very different way. Now look at the other 3 in between. The one that's in the middle, overextended, this is one that sometimes gets kind of misdiagnosed as burnout because people are having the stress response, they're feeling exhausted, but they're doing okay and everything else. Their one big problem is workload, huge problem. And if that can be fixed for them or improved, they're going to be around the norm, sort of good, not really bad kind of thing, average. They are not burned out, though. Look at the difference between them and the people on the far left. The one that looks more like burnout is disengaged, and those are the people who have developed a high frequency response of cynicism, negativity, wanting to distance themselves from the job, from the people, from everything that's going on here. The ineffective profile, it looks a little bit more like engagement. They're fine on their workload, but boy, the reward is the lowest, the community, they're almost like, doing their job, but not getting much out of it and not feeling as good about it as they could. So these 5 profiles have different psychological, social responses to what's going on. And the mismatch is great with burned out. It's not with engaged. So how do we do a better match? Well, what we do now often is we match people to the job. We train them, we educate them, we give them the skills, we give them the experience so that they can fit with the job and do a good job. And when they have difficulties and are facing stressors, we teach them how to cope. How can they be stronger? How can they eat more healthy, get more sleep, be more resilient, take care of yourself is one. A lot of strategies there. But it's also time away from work. Take a break, take a vacation, get reduced hours, don't show up, absenteeism. Which begs the question, why, if the job is so bad that the best way to cope is to get away from it, we need to do something else. Let me just point out that all of these strategies of matching people to the job do not change the job. They don't make the job better, less toxic, less stressful. So it's helping people match, but it's not really dealing with the problem that we see with burnout. You could do it the other way around, and actually there's more potential here. Match the job to the people. And again, this is not entirely new. We do this when we use ergonomics, which focuses on the physical environment, the work environment. So you change and modify conditions that cause any negative outcomes for employees. So for example, we redesign chairs, or we redesign computer stations, or we redesign, assembly lines, or the beds for patients, or anything that will mean that people are not going to get musculoskeletal disorders, are not going to have neck problems, are not going to have carpal tunnel. They won't hit the wrong button or pull the wrong thing when they're having to work with machines. We're focusing on how the physical environment can be better adapted so that people can work well. So what do we do now? We want to use that same approach, matching the job to people, to the social and the psychological environment, not just the physical one. And social psychological, this is really saying what makes people motivated, what makes them tick, what makes them be creative, do good things, figure out new solutions. And basically, we're adapting the job to the whole person, and you get a better match when you make changes and modifications to the job that actually help promote these core psychological needs that all of us need in our life, in all areas of life, but in the workplace is what we're focusing on. So having a sense of autonomy, having control, some appropriate discretion and choice on how I do my job well, feeling like I really belong, I'm part of the team, I'm part of this place where I'm working. A sense of competence that I can do my job well and I can be able to get better and learn other things. Psychological safety. This is not just physical safety. This is safety from discrimination, from bullying, from people being uncivil and not helpful. Fairness, as I mentioned before, deep core need that whatever the rules are, it's applied fairly. Meaning, this is the values. This is what is the purpose of what I am doing? Am I getting great satisfaction in what I am able to do as I work with patients, as I really help make people's lives better? And there's a reason why I'm here in healthcare. And finally, positive emotions, a need of just having times in life when we can celebrate, when we can laugh, when we can feel good about things. And how does these various things in the workplace help that as well? So if you take those 6 areas that I mentioned before of mismatch, let's pivot and say, what would be the positive end? Let's not focus on the negative. Let's look at what we might try and aim for. So instead of a overload, we're looking for a sustainable workload. How do we build in appropriate rest and recovery? How do we redesign how we do the workload and the responsibilities? How do we build in appropriate levels of choice and control over the work that we do? How can we protect against things that tie our hands and not let us do what we want and think is right? How do we build in a better sense of recognizing good work when it's done? And it turns out the research is not just about money or benefits, it's about recognition, that other people realize that what you have done, and you, in turn, give recognition to them. A supportive work community rather than a toxic one, where we figure out ways when we disagree to work out problems, you do problem solving and come out with a better thing, where we help each other out, where we cover for each other in appropriate ways, and I do that for you, you do that for me, that we know we can go to people when we have trouble and problem rather than thinking they're really going to just put us down and not treat us well. Fairness, again, respect. This is really what is, when you're treated fairly, you are being respected as somebody, who has a place in the whole operation. And how do we work on improving that? And how do we make clear the values, the meaningful work, and how do we celebrate the successes we have and what we think we are doing well? So how do you make those changes? A couple of points to keep in mind. One is everybody has to be involved. It can't simply be something from top down saying, okay, now we're going to do X instead of Y. The people who are going to be affected by this need to have direct feedback. They need to have buy-in. They need to be a part of it. They may not have the best ideas, but they all have ideas of how it might work, and they have to be willing to do it. So to reach out, listen to everyone, figure out of all the 10 things we could do about a particular issue that we have on community or on reward, what might be the best one to sort of start and try? What are we all going to do? Customize it. There's no one answer. There's no one size of best practice. You really always have to adapt it. What works in healthcare might not work, the generic principle, in teaching or in tech industries. You have to take the general principle of building a better community, for example, or doing a better job of fairness, as it would work here where we are. And third, there has to be a commitment to say, we're going to keep working at this and making changes and modifications until we get it right. We know where we're going. We're trying to get a more sustainable workload, and we're going to keep track of it, progress, but we're going to keep working because this is important to do, or to change some unfair policies, or to build in opportunities to have, positive or celebrations. So in conclusion, there's really many, many possibilities within all of those 6 areas. You can take a list of any one of them and start generating where are the problem areas, where are the strengths, where should we begin? So there's many possibilities to begin to improve the good match between people in their job. And there's no one change, as I said before. All of these changes, they can be small. They don't have to be big ones. They have to take care of a chronic job stressor. They can be inexpensive. Some don't cost money at all. They should be customized to us, to our situation. And basically, as we begin to sort of continually look at how we can begin to make these continuous improvements as the world changes and the workplace changes, and it will again, as it just has, working on creating and sustaining a healthy job environment is going to take care of both the workers and the workplace. So the former will thrive and the latter will succeed. So thank you very much for inviting me to share with you what I and my colleagues have been learning about job burnout all of these years, and now recognized officially by the World Health Organization. There is a path that we can take to fix the job and the people and get a better match for everyone. Thank you.